Welcome to another episode of Med Madness. Today we're delving into a crucial topic for medical students and healthcare providers alike, common problems related to lactation. Understanding these issues is vital for providing comprehensive care to breastfeeding mothers. We'll explore the various conditions that can arise, their symptoms, diagnostic approaches, and management strategies, concluding with a real-world case study to bring these concepts to life. Next, let's discuss what this condition is. Lactation issues encompass a range of conditions that affect breastfeeding mothers. These can include engorgement, nipple injuries, plugged ducts, galactoseals, mastitis, abscesses, and mammary candidosis. Each condition has its own set of causes and risk factors. For instance, engorgement often occurs 3-5 days post-delivery when colostrum transitions to milk, leading to high milk production. This process can be exacerbated by interstitial edema resulting from decreasing progesterone levels. Other conditions like nipple injuries usually stem from poor latch techniques, while plugged ducts and galactoceles are often due to milk stasis. Patients with these conditions present with a variety of symptoms. Engorgement is characterized by bilateral breast fullness, tenderness, and warmth without fever. Nipple injuries manifest as abrasions, bruising, cracking, or blistering. Plugged ducts cause focal tenderness and firmness but no fever, while galactoceles are subareolar, mobile, well-circumscribed, non-tender masses. Mastitis presents with tenderness, erythema, and fever, and abscesses show similar symptoms but with a fluctuant mass. Mammary candidosis, on the other hand, presents with unilateral, stabbing breast pain and nipple scaling. Diagnosing these conditions involves a thorough clinical evaluation. For engorgement, the diagnosis is often clinical, based on the timing post-delivery and the bilateral nature of symptoms. Nipple injuries are diagnosed by visual inspection. Plugged ducts and galactoceles are identified through palpation, while mastitis and abscesses require clinical evaluation and sometimes imaging, like ultrasound, to confirm an abscess. Mammary candidosis is diagnosed based on the characteristic pain and nipple appearance. Managing these conditions effectively is crucial for the comfort and health of the mother and the success of breastfeeding. Engorgement is managed with cool compresses, acetaminophen, and non-steroidal anti-inflammatory drugs to control symptoms. Establishing regular breastfeeding or pumping is essential. Nipple injuries require correction of latch techniques and sometimes topical treatments. Plugged ducts are treated with warm compresses, massage, and continued breastfeeding. Galactoceles often resolve spontaneously but may require aspiration if symptomatic. Mastitis necessitates antibiotics and continued breastfeeding, while abscesses may require drainage. Mammary candidosis is treated with antifungal medications. Consider a patient who presents 4 days post-delivery with severe bilateral breast fullness and tenderness. She has no fever. On examination, her breasts are warm and erythematous. The diagnosis of engorgement is made. Management includes cool compresses, acetaminophen for pain, and encouragement to breastfeed regularly. As she establishes a feeding routine, her symptoms gradually improve, demonstrating the importance of early intervention and proper management. In summary, understanding and managing common lactation issues is vital for supporting breastfeeding mothers. Early diagnosis and appropriate treatment can prevent complications and promote successful breastfeeding. Engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Thank you for tuning in to Med Madness, and stay tuned for more insightful episodes. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io?UTM_source =11labs_GPT.